is there anything that carnivore would be missing out on specifically that they need to thrive that they would get from plants?
That is an extremely good question. And for many people, it is the opposite. In other words, for most carnivores, they have gone to a carnivore specific diet because plants have caused some kind of a problem in them. It has elicited an immunologic response. It has caused some issue with their body because plants have toxins. Like we talked about before, plants can defend themselves not through fangs or claws or some kind of physical physical way to kill their prey, but they do biologic warfare, they do chemical warfare. They have toxins in them. Phytates is one of them, and these can prevent absorption of important nutrients. There are other plant based toxins like lectins that can damage us. And another way through which plants can mess us up is by diluting the stomach acid. So many people who are used to eating large amounts of raw vegetables, they're taking in bacteria along with the vegetables that they are eating. And the stomach acid is an ecological barrier that is designed to kill the bacteria before they enter the small intestines. So the small intestines are considered to be what I would call as bacteria free. And if you eat a lot of plant food, especially raw plant food, you may overwhelm the capacity of the stomach acid to neutralize it. And you may be introducing bacteria into your small intestines. And that can cause inflammation in the small intestines and lead to SIBO. So I took it from a standpoint in which I'm saying that, hey, be careful with a lot of plant food because you may be harming and damaging yourself by the mechanisms that I described. But there's a contrary opinion also. And the contrary opinion comes from a few very well done studies in humans in whom they were changed from like a regular omnivore diet that included both plants and animal food to a completely animal food diet. And I was shocked to see in that study that the gut bacteria, the bacteria in the colon, changed within a matter of 48 to 72 hours. So the kind of bacteria you had there was completely different. And in that paper, they argued that the colon receives some of its nutrient supply by the breakdown of fiber by the gut bacteria when they make small chain fatty acids. So, if you're not eating, let's say, even the most minimal amount of fiber, it is possible that you will starve the lining of the colon from a nutrient standpoint because you're not making any of the short chain fatty acids. I'm not sure how clinically relevant that is because there are a number of carnivores ever since this revolution started, and they do just fine. But if somebody comes to me and says that I feel individually and personally a little bit better by consuming small amounts of fiber and small amounts of carbs, I don't think that we should be so rigid because the human digestion is designed not to be a complete carnivore, but there is options of being an omnivore also. So I don't want to go that rigid and say carnivore is the best diet, you don't need plants at all for every single individual. I don't think our knowledge is that refined and good at this point. On the other hand, if you're like Michaela Peterson, then absolutely be on a complete carnivore diet because the plants are toxic to you. You're too sensitive to them.
While you bring her up, it brings up for me the fact that she came to this diet from a place of being sick, which we can't ignore the individual aspect of where a person's coming to this information, such as what we're bringing forward today. Are they metabolically healthy? Do they have a chronic disease? Versus somebody who is taking on eating this optimal diet from a place of health. So I think we need to look at the individual person and what their body's been through and what healing it needs when we're deciding on this optimal diet. And it's not going to be a one size fits all.
I couldn't agree more. Diet has to be individualized. Now, if you come from a situation in which you have autoimmune disease, you have psoriasis, you have rheumatoid arthritis, lupus, some other joint manifestation, some other uh, inflammatory disease from which you're suffering, polymyositis, then an exclusionary diet, in other words, eat something that would cause the least degree of inflammation. And that would include not just a carnivore diet, but a specific version of the carnivore diet, which is called the lion's diet. A lion's diet is one in which you're eating nothing but meat, salt, and water. And from there on, once you improve your health, then start adding different animal food in there, maybe dairy, maybe eggs, maybe ham, pork, chicken, and see if that is messing up your health. And if it is not, that means that you have this range of diet that you can follow. But there may be a situation in which your body is so sensitive to the anti nutrients or the substances in this diet that you may not be able to tolerate anything but the lion's diet, which is what Michaela Peterson is on. On the other hand, if you're coming from a situation of health, and a situation of health meaning that you feel good, your body weight is good, your muscle mass is good, you are insulin sensitive, your cholesterol quality is excellent, your blood sugars are fine, you don't have any inflammation, then you are free to try an omnivorous diet with a range of food that is available to you. So I am completely a proponent of individualized diet. If somebody comes to me who is metabolically healthy, then I don't try to change their diet.
Coming back to the plant toxin piece, you mentioned phytates. There's also, lectins, oxalates. We could go on and on. Do you find that if a person is healthy, they can tolerate those to a certain point? Because you have this continuum in our world of people that say avoid them at all costs, that it's BS and we don't need to worry about them. Again, everything we're going to talk about today has to be with the caveat of it depends on the person and their health status at that time. But in a general sense, for a healthy person, quote unquote, how big of an issue do you find those?
Very good question. For example, many people sell something called lectin shields, uh, you know, supplements that you can take. And I would say perhaps for the majority of people, they are completely unnecessary because you know that when you take a food that is high in lectins, like let's say beans, and you soak them overnight in water or you cook them for a specific amount of time at high heat, like for about an hour, all those lectins are neutralized. And the vast majority of healthy individuals can take them without any problems. Same is the case with phytates. So, phytates are found in nuts. Now, unless you're eating raw nuts, which I would not advise, but if you roast the nuts or if you soak them overnight, the phytates similarly get neutralized and they don't bind calcium and magnesium. They don't prevent they don't prevent protein from getting absorbed. So I would say yes, that you can do certain things to food which in normal healthy individuals would negate the adverse effects of phytates and of lectins. Oxalates may be a slightly different story in people who are susceptible to kidney stones. And I'm not sure if there is enough data to implicate oxalates in coronary calcification. In other words, plaque buildup and calcium buildup in the blood vessels of the heart or vascular system in general. But people who have kidney stones should definitely try to avoid oxalates, which would be found in leafy green vegetables, in nuts, in certain kinds of teas. And it's perhaps always good to modulate the amount of oxalates that you're taking. So, there are several individuals who just listen to somebody who is a plant-based, whole food plant-based, uh, expert who is recommending that kind of a diet, and they just eat nothing but spinach and broccoli and other leafy green vegetables. And I think these people are in significant danger of getting a kidney stone or getting some other health issues as a result of the way they are eating.
Argument I could see somebody making, and I'm not saying this is where I stand, but hormesis. So these plant toxins in small amounts, whatever that is, could they be having a positive effect, just like going in the sauna or exercising or doing these different fasting? We could go on, these different stressors that are considered healthy. So if we got the right amount, could that be a healthy thing for the body?
That's a very interesting and provocative view that we should look into. I have not myself read any studies that talk about hormesis coming from the right amount of phytates and lectins and oxalates, but it is possible. So I'm not going to say that that theory is not valid. I just need to investigate it further.
And we know that when someone's on a plant-based diet, there are certain nutrients they're not going to be getting that are found only in animal products. But this ties back to a question I had before. Do you feel like there's anything specifically the other way around where, whether it be polyphenols or something specific that's a phytochemical, that a carnivore or somebody who is basically avoiding plants could be missing out on? And the polyphenol piece, I've actually heard from Dr. Gundry, I believe, that depending on what the animal's eating, that meat will contain some polyphenol. So it's very intricate, but I'm just curious, do you find from many of the research you've done, there's anything in plants, of course, fiber, which we touched on last time and you've touched on it quickly today, but I know you're not a big fan of that. Anything specific we could be missing out on that's only in plants?
So I give you two substances with a question mark. In other words, we are not sure if these are actually completely required and missing from an animal sourced food or animal sourced diet. So one of them would be vitamin C. Vitamin C levels in meat may be not as much as what is the recommended daily allowance for humans. However, there has been extensive studies that Amber O'Hearn has evaluated, and I heard one of her talks in which she says that when you are on an animal sourced food diet, the requirement for vitamin C goes down. So taking less vitamin C would be okay in that situation. But it is possible that you would be vitamin C deficient from a recommended daily allowance if you were taking a complete animal sourced food diet. The number two one is the one that I already alluded to, which is that the lining of the large colon perhaps gets its nutrient supply from small chain fatty acids that are a fermentation product of fiber by the colonic bacteria. So, given apart from those two caveats, flavonoids, whether they are actually necessary or no as antioxidants, are they superfood? Do we really need them? Is a huge question because we attribute a lot of benefit to various different kinds of foods in terms of antioxidant ability and the nutrients that they contain. But whether it actually translates into a clinical in vivo benefit, in other words, benefit inside the human body, is perhaps unknown. And I think that the best antioxidants are made in the human body itself. As you are making cholesterol, you improve antioxidant enzymes. HDL is a very strong antioxidant. LDL is a very good antioxidant. So there are many antioxidants that we make which are perhaps far superior than the antioxidant ability that we are assigning to various fruits and other chemicals that we are ingesting.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Phytosterol levels are significantly increased in people who are taking a statin. And this phytosterol is causing damage and harm that has not been properly investigated. With regards to the canola oil,